So here we have seen the real monitoring screen. And here we have seen that the monitoring sequence is ready. Now we will press the monitoring button. Press Start. After monitoring, there are limbs, lower limbs, NGO and then bench press. So 2 scans will be done. One is the arterial phase and the other is the bench press. After pressing the Start button, monitoring has started. Contrast is starting to appear. The monitoring graph is slowly increasing. The more the density, the better the graph will be. The monitoring will continue. The contrast graph is increasing. The contrast density will increase by 100 HP. The scan of the NGO will start. But before the scan, the delay time will be 14 seconds. The scan will start after 14 seconds. As you can see, there is a noise second. After 9 seconds, the scan of the NGO will start. After the scan of the NGO will end. Now we will do post-processing. The post-processing technique is the same as all the NGOs. The CPR is the curve planar reconstruction. The arteries are not straight. But we can see the arteries through CPR. We will draw a line through the arteries. We will draw a long line through the arteries. First, we will draw a normal artery. We will draw a normal artery. Maximum intensity in projection image left. Axial CT image right. This is the long line. This is the mid-image. The long line is the axial image. If we look at the level A, the abdominal area. This is the abdominal area. If we look at the level A, the abdominal area. The scan is starting. The kidneys are starting from the arteries. This is the abdominal area. The level B image is this. The level B image shows the 2 external iliac arteries. These 2 are the atactor and atactor. Then we come to level C. We see the 2 arteries. These 2 arteries are called femoral arteries. This is the femoral bone and this is the femoral artery. Then we come to level D. This is level D and this is level E. We come to the knee joint. The artery behind the knee joint is white. This artery is called the popliteal artery. We come to level E. We see the arteries in level E. The arteries are called dorsalis peris artery. This is the normal endogram. There are some calcifications in some places. We see the common femoral artery. This is the common femoral artery. Then we come to the profunda femoris artery. Then we come to the superficial femoral artery. This is the popliteal artery. This is the knee joint. Then we come to the knee joint. This is the popliteal artery. Then we come to the tibial peroneal artery. These three are anterior tibial artery. This is the posterior tibial artery. This is the peroneal artery. Now we see some pathologies. The arteries in these two endodrams are called the borders. The borders are not equal. The problem here is the severe atherosclerotic disease of the intrapopliteal segment. The problem here is the severe atherosclerotic disease of the intrapopliteal segment. Especially in the popliteal segment, the arteries are atherosclerotic. There are many plaque in the arteries. This is the typical diabetic peripheral vascular disease. The next slide shows the CT endogram MIP image and VR image. Volume rendered image and MIP image. CFA means common femoral artery. This is the common femoral artery. This is the deep femoral artery. This one is the deep femoral artery. SFA means superficial femoral artery. PA is the popliteal artery. This one is the MIP image. This one is the BRT with bone. This one is the MIP image and this one is the BRT bone. This one, both are lateral image we see. In the lateral view, we can see all the arteries in the tibiofibrilloid region. This TPT is the tibioperoneal trunk. This is the perireno-peroneal artery and PTA is the posterior tibial artery. And ATA is the anterior tibial artery. And this is the plantar artery and this one is the arterial dorsalis pedis. So, this is a normal example of the dual limb arteries. And now the abnormal case. So, this is showing an occlusion of the both superficial femoral arteries. So, here we can see that the femoral arteries are occlusion or narrowed. There is a gap because of the occlusion. So, note that below the knee segment, atherosclerotic isis, this knee segment is okay. The diffuse calcifications of the left leg are dependent on the severe, its consistent chronic venous insufficiency. So, in the left leg, you can see that this is the chronic venous insufficiency. Notice that there are vessels all around the thigh. Look at that A image, A and B. This is the occlusion, the distal third of left accept. Notice that the arterial dorsalis pedis are not occluded. The reason for this is the occlusion. There are plaque jumps. Because of the plaque jumps, the arterial dorsalis pedis are more. So, notice that they are not occluded. Next is CTA and DSF ending. So, CTA angiogram and digital subterranean angiogram are shown. This is number C, DSF. Look at this first, there is a clear gap between the arteries. B is the post-standing image. After replacing the stand, the angiogram is done. After applying the stand, the angiogram is done. If you look at it, the contrast is clearly visible in the arteries. So, what pathology is there here? In this image, we can see that this is DSF, digital subsection angiography and 3D BR reformat. These are BR images. And what we see is the intraproprial bases. Now, the severe atherosclerotic disease is the occlusion of the posterior trivial arrowhead. This arrowhead, this artery, we can see here, severe atherosclerotic disease is there. And the peroneal arteries, this peroneal arteries is there. This is the peroneal artery occlusion. The anterior trivial artery does not show significant stenosis. This is the anterior trivial artery. This is the peroneal stenosis. This is the anterior trivial artery. This is almost normal. So, this image shows more pathologies. So, DSA, A and B. This A image is DSA and this B image is DSA. And C, C, and B are BR reformat. So, B is BR and C is B. And this E is B. A bright lower extremity shows the correlation between the two techniques. Note the severe stenosis of the propria and anterior trivial arteries. So, even the propria and anterior trivial arteries show stenosis. Because they have not shown the arrowhead, so far said. And there is occlusion of the anterior peroneal trans. This is the anterior peroneal trans. There is such an occlusion. And there is reparmic pyragicization of the peroneal artery. And here, the peroneal artery is reparmic pyragicization. So, there is a stenosis after the operation.